No. Thanks, Kate. So today we have Alison, Dawyd, and Erin Dickinson from the Leisure Days Adult Day Support Services. And so they're going to tell us about their program and some of the background to it. And then we'll have some resources and FYIs just at the end of that. And then just letting you know about our next meeting on May 27th. We'll have the Lacklabish Stone Soup Food Center coming to present around food security in that area. So I think what I will do then is just to stop sharing and let Erin and Alison take over there. There you go.
Hi, everyone.
Good morning.
We're just going backwards for everyone this morning because first day back from Easter. So as Helen said, my name is Erin. I am the rec therapist here and executive director at Leisure Days Adult Day Support Services. And this is Alison. She is our rec manager. Yeah, we became a nonprofit in 2024. Previous to that, we were a corporation since 2021. 2001. Don't ask me to do numbers, it's really scary. About our organizations, like I said, we're a nonprofit. We operate out of 3 different communities just outside of Edmonton. So we're in Sherwood Park, Fort Saskatchewan, and Leduc. We hold contracts with Alberta Health Services to provide day programs, which we have been providing in these locations for about 20, almost 30 years in some of them. We provide wellness day programs. We are both recreational therapists. We also have a huge focus on providing respite and caregiver support within our programs also. We also have 2 family-funded days in our Sherwood Park site that are not contracted with Alberta Health Services that we're going to touch on a little bit more a little later on, which just provides extra support in the Sherwood Park location. And yeah. So for our AHS funded days, Fort Saskatchewan and Leduc are strictly AHS funded days. We get all of our referrals through Alberta Health Services through day program intake. The cost is $15 per day to each client to attend. All clients in those days must have a home care case manager and then a referral sent from home care to day program intake, and then they were filtered through to what program they think they are most suited for. Sherwood Park, we have 3 days in a week. Leduc and Fort Saskatchewan, we have 2 days. AHS also limits the number of clients we can have per day. So our Fort Saskatchewan and Leduc site, we are funded for 10 clients per day to attend our day program. And in Sherwood Park, we are funded for 15 per day. We also provide for all of our sites, we provide caregiver support groups. Some of our struggles that we have with our funded days is that we have very limited control over clients' admission dates. AHS tells us what day to admit each client to. And also they have limited numbers of days that they're allowed to attend. Each client is for sure given 1 day a week with a possibility of 2, but for the second day, everyone has to go back on the wait list. And then like right now we're seeing waits averaging 3 to 4 months at all of our sites, even 8 months. Because if someone doesn't leave, no one new can come in. Even though there's quite a few people that are really needing the support. Also, the other things that we kind of run into struggles is if people are having bath days already on the days that they pop up for a day for the day program, we're often having to deny them that day because the family prioritizes their great bath person that comes in and gives them a shower at 1 o'clock in the afternoon, which I do not, which to me, if I have someone great that gives me a bath on a Wednesday afternoon, I am not switching. I would not switch either. So that's one of the other big struggles that we're having is other supports coming into the home, conflicting with the day program days that they're being admitted. And then they have to go back on the wait list till another day comes up, which can be very frustrating for a lot of families, especially when they've been waiting for so long. One really nice thing though is that it is $15 a day for the clients to attend, which is mandated by Alberta Health Services, the amount that we can charge. That did recently go up last year from $10 a day as of April 1st, 2024.
All right. So I'm going to talk a bit about our family funded days, which I manage in Sherwood Park. So we have we've been playing around with these quite a bit. They started out as 2 full days on the Tuesdays and the Fridays for adults in the community who are living with, who are dependent, who have a caregiver, who need socialization, that kind of thing. Very, very similar to our already running AHS days. So we found it was kind of competitive. We're competing against ourselves in trying to get clients to attend our family funded. The reason we opened them was not to make lots of money. It was to help caregivers. We were finding that they get approved to attend 1 day. Caregivers got 1 day respite, and they were finding that they could use more days, and then waiting on the wait list again was too long for them. So they were asking, is there any other way I can have more days? So the family funded days started. Usually we got about sometimes like 4 clients, which makes it very hard to run when it's family funded. As you know, family fund is just a fun way of saying you're paying for absolutely everything. So it costs about $80 a day for us to have 1 client here if we can get 6 clients. So the less clients we have, you still need 2 staff at all times. We still serve lunch. So these are kind of the struggles we were having with our days. We decided in February to open up an intergenerational day. So the Tuesday is intergenerational. We piloted it February 2023. If you ever want to search it, we were shown on CTV and Global and I think CBC as well. So we piloted an intergenerational program where we have kids ages 4+ coming to the program with our seniors. And the pilot went really, really well. We learned a lot, and that is like a whole nother presentation. It's very different speeds. That was the big thing. You've got kids running at 1,000 miles an hour and then seniors not even close. So it was a huge learning shift for us. The benefits of having the intergenerational program was that parents are looking for something for kids to do. It was the seniors and the kids we found they are very compatible. They have similar cognitive abilities, similar interests. The kids get to help teach things. Something we weren't expecting was how dependent our seniors were when you have kids around. So there was a lot of growing. The positives of having our intergenerational and our family funded days is we can be as creative as we want. AHS isn't telling us what we get to do. We still limit it to 15 clients. And the clients don't have to have home care to come. It's like self-referral, which is positive. We've had clients who they might be visiting from out of province, like the families brought them in because they need help, but they live out of province. The caregivers in that province can't provide help for like 6 months. So they come to live in Alberta for a bit. So we've found that because we don't rely on HS, they don't have to have any connection to the healthcare system, then they can just come to those days. Struggles would be marketing. It's us, and we are rec therapists, not marketing people. So it's hard for us to get the word out. I think that's our biggest problem. When I was able to offer it for free, for the pilot, we had kids lined up and seniors. It was a huge thing, but I don't know how to get it out, the word out there. Families take on the full cost. So originally we started at $80 for seniors, 40 for the kids, but then we're competing against daycares who are now less expensive. So there's a lot of struggles that way. We've done a lot of fundraising, which has helped, and now we've been able to reduce the price, but we don't know how long that can last for. Yeah, so those are kind of what we're leading for our family funded days.
Alison, there's just a couple of questions from Michelle in the chat box there. I thought just having to do with this, so if that's okay. So I think you answered the capacity issue there, but she was wondering how much of the cost is the facility rental and the lunch part of it? How much does that come to?
So this location, we're at a fixed monthly rate, and we're the only renters in this space. So we're at 15, just over $1,500 a month, Monday through, like, we have it rented only to us 7 days a week for the entire year, right? Which we divide that cost between all of the sites. Food costs, we try and budget around $5 per person attending, which is not very much, but we have some amazing cooks that are very budget wise and very budget friendly. I think the biggest struggle also with food is having food that our grand friends enjoy, which is what we call our seniors in the intergenerational day program, and our little leisure leaders, which are our kids that attend, right? Finding common meals for the two of them. So lots of times we're having like multiple meals being made, right? Because the kids like chicken nuggets and only 3 of the other clients like nuggets. But everyone loves fries and hot dogs. So if we could just serve that every Tuesday, we'd be fine. But I'm sure someone would get tired of that.
And then Michelle, I see you've come off mute, and maybe you can talk more about your second one there about the Google grant, because I don't know about that one. Oh, we're not hearing you, are you?
My headphone piece is, or my microphone, my headphone is messed up.
There we go.
You guys just mentioned that getting the word out, and if you're a registered charity, or sorry, a registered nonprofit, you can apply for the Google Ads grant, and it's $10,000 a month, every month in free Google Ads. And there's also like other nonprofit funds that are available for like tech people. They'll pay their wages so that they can do your marketing for you.
If you have any like direct places to look for that, we would 100% appreciate it.
Sure.
We've been learning a lot in this last year.
Yeah.
Since becoming a nonprofit.
Yeah, I'll connect with you and we'll just do a one-on-one.
Or if you have it, to put it into the chat box, because there might be other folks on the line that
Sure, yeah.
able to.
They're all just a little different, but yeah, I'll put my information in the box.
Super, thank you, Michelle.
Yeah.
Thank you.
Great, back to you.
Okay, so yeah, like we are it. Basically, there's one other person with us, and switching to a nonprofit. Now we're doing everything. So it's nice to have help in figuring out what else is out there and what else we can grasp. We've learned a little bit, but it takes a while, and we're doing it kind of on top of what we're also doing for the program. So I just wanted to give you kind of a rundown of what we do in a day. So our day is, again, wellness. So we focus on the 5 areas of wellness: social, cognitive, physical, emotional, and spiritual. And we try to fit them in to different activities we run throughout the day. So our day opens up at 9:30 in every single location that we have. And then we run until pick up between 3 and 3:30. We focus in the morning, get everybody here, settled down. This has been working for us for several years. So we kind of just stick with what works. We had to adapt it quite a bit once the kids came up because a 45-minute program, they are done in 5 minutes. And then, oh my gosh, we have a lot more time to fill. So from 9:30 to 10, we usually do some sort of coffee, chat, social. Staff will sit around with clients, just visit, catch up on the week. 10 to 10:30, we usually do some sort of trivia, news, which we try to focus on the happier news.
It really depends on the clients that are in on that day. We have some clients that are really into, politics and things like that. And as long as it's not getting too heated, we will support it, right? But yeah, other clients, they would do better with games in the morning or with, just fun trivia or thoughts, right?
And so in that part, we're focusing on the social, the cognitive, emotional. It's very interesting how different our sites are.
And each day.
And each day is different. So depending on who's admitted for the day, you can have a very high cognitive functioning group with some people who have very limited physical. So then we have to adapt each activity based on who's attending and what group it is. I recently switched, or several months ago, switched and started with the Leduc location, and as a group, their cognition is so much higher than in Sherwood Park, which is just who's there currently. And so I was trying to do a word game with them, and I would put one letter on the board and they'd guess the whole word. And I was like, oh, dang. Shoot. So it's very interesting to see how different things go. We always have an exercise piece in our day, around 45 minutes, seated exercise. We're not physio or anything, and but we do have goals to keep them as motivated and moving as much as possible. Usually after that, we have a fill-in time before lunch. We do things like hangman, giant crossword, any kind of cognitive word puzzles. We have a lot of people who enjoy those kind of things. And again, depending on the day. Then we have lunch. We have a cook who comes in, serves everybody a warm lunch. And we give an hour for that. We run it as a program. So it's just as important that they sit for an entire hour and eat. So we're not rushing people. We have varying abilities for eating. So we just want to make sure that everybody has the time, doesn't feel rushed. We do serve a dessert, coffee again, and just give them a break. Also, as staff, we don't have any breaks throughout the day. So this is kind of our time you can kind of watch everybody from a distance and have your own kind of a break.
For about 10 minutes.
Eyes always on the ground. After that, we usually in the summertime try to get outside, try to do some sort of a walk. We also might do seated yoga or one of the more active games like cornhole. We have one of those axe throwing from Costco, not a real axe. New families are like, what axe? It's just it's rubber. So that again, cognitive, physical, spiritual piece. From 2 to 3, we usually try to have some kind of musical entertainment. We will do art sometimes. There's those armchair travels. We have access to activity connections and golden carers, which are online, and we just you can pull from those pieces.
They have lots of trivia, different monthly themes that you can follow.
And then finally we do our pickup at the end of the day. So that's how our day works. Again, it's varied for the intergenerational day. A lot more pieces moved in, and we found it's better to separate the groups at certain parts of the day, let the kids go burn off their energy. Outside, we have a little playground, which is nice because we're in an affordable housing unit. And so they have a little playground out there. So we just send them outside so that the sound can be pretty overwhelming for some seniors sometimes. So, and we have found, we started with 8 kids. It's best with only 5. Anyways, so
Mhm.
can't read my, okay. The benefits that we've found is that there is additional caregiver support with our family funded days. Like I mentioned, sometimes families just need, we have some clients who come 4 days a week. So their family pays for the 2 family funded days and then attends a couple days with AHS. Oh, and I forgot to mention our Fridays are only half days. Fridays are very hard to fill. And it's just, by the end of the week, most of the clients who come on Friday have come several times in the week, and we find they sleep all afternoon anyway. So we don't have very comfortable chairs. They're not comfortable. It's awkward for us. We don't know what to plan or what to do. So we just suggested to families that possibly we'll stick with unless we get this increase of clients, but it's only a half day. So all of our activities are recreation therapy based, sorry. So again, benefiting the overall wellness of clients. And it is cost effective. $80 a day sounds intense, especially when you're competing against yourself at $15 a day. However, if you were to hire a private caregiver to come into the home, that price is a lot more. So having the group and the day program and the location and all that is a lot more affordable. You just have to sometimes remind families of that if you were to hire someone to come into your home, like a recreation therapist or personal care giver, you are going to have that fee going up quite a bit more. So yes, our future vision, I'll just touch a little bit on this and Erin will continue on, but we definitely see the benefits of both. After taking over in Leduc, I definitely have seen that we could use more days out there. In Leduc, we rent in a church. So the cost is, so it is a shared space. We don't have our own space. Our office is a cupboard that we lock. So it's not the best and most easily expandable, but we have families who have been begging for a second day for 6 months now, and I cannot get them in. We just have the wait list is so long, and AHS prioritizes first days. So it is quite a struggle to meet everybody's needs, but then opening a third day does there's that cost benefit that we would have to do. So we do have some ideas to expand it, which I'll let Erin talk about a bit.
Yeah. That is one thing that we're seeing in a lot of in Fort Saskatchewan, even, and in Leduc, more of our rural settings, is that there is so much of a need. And talking with other rec therapists in smaller rural communities too, is how much they've seen that a day program would benefit, or could benefit from their areas. So we have been thinking and dreaming for quite a while how nice it would be to have like a traveling day program or a leisure limo that we could just bring out to other rural areas and, run day programs, even if it was just once a month for caregivers and a place for caregivers to connect. I know I mentioned before our caregiver support groups, the amount of benefits we've seen from a lot of our families from attending those has been amazing. And especially in rural communities, lots of times the only time caregivers can get together is if they go online or go in the city. And that is very hard. And as someone who's lived rural her whole life, I hate going in the city. And I'm not even that old yet. And I could imagine being 80 driving in there because I don't want to do that now. Right? So just looking at different ways or other communities that we can maybe partner with to help bring supports like this out there, places where there is someone, kind of being a second voice or an extra help to those caregivers and those communities too. But yeah, that's kind of us and our dreams for the future. All of these pictures, by the way, are a lot of our clients, past and present, who've attended the day program, a lot of our intergenerational photos. So they are honest people and they've all been approved to be on there. But yeah, and then just if you ever want to get in touch with us, we do have Facebook, Instagram, we have our website, and then our direct emails there also. Yes, any questions?
So we have some things in the chat box here. Oh yeah, so Michelle has put her information in there, and Carolyn just added around for those who, maybe are on the wait list. But there is the Senior Center Without Walls, which is
Mhm.
Just because my
audio and
microphone's broken, I'm gonna turn it off. Thank you a second.
oh, there, Michelle, we can hear you there. That's okay. So just that's in the chat box for people to see there. Um, so Kathy was saying, do you find that moving locations is confusing for the senior, or do they adapt?
So we, like in Leduc, we're in the same church every Monday, Wednesday, right? In Sherwood Park, we're in the same room Monday through Friday. Fort Saskatchewan, we're in the same church. We've been there. I was a student in 2011, 2012, right? We've been in the same church since before then, right? So we don't actually move physical locations.
The seniors don't move. So if you're in Leduc County and you've gone through their home care, you'll be referred to the Leduc
Day
Day
program.
program if you're in Sherwood Park, and then Fort Saskatchewan. So the seniors don't actually move, just staff is confusing it.
Yeah.
I never know where I'm supposed to be.
I never know where I'm supposed to be either. It's fine. I think I have to go to Fort Saskatchewan today, or maybe that's tomorrow. I don't know. Just
Asking if you can go I think it's one slide back to your contact information, so people
oh.
can
Sorry, yeah.
take that, and we'll be sending out the slide deck afterwards also, so people know that with the recording with it there.
Yeah.
Okay, and then Michelle, you were saying that you can provide space and food for downtown residents. Just wondering what that's related
Yeah,
to.
we can discuss it more later, but I've got a 4,800 square foot facility that's a commercial kitchen space on kind of half of it, but the front half is a full dining room and restaurant, but we're not using it as a restaurant. It's a third space, community space. And they have got some really nice long tables. And so if you wanted to run like a half day or a day, see how it goes, it's all accessible and
Yeah, there is so there is there is quite a few day programs in Edmonton already. Again, with all their own wait lists. Elder Care is probably the most similar to our organization, where they're also a nonprofit that holds contract with Alberta Health Services, and they have 3 to 4 day programs in Edmonton, with one day that they're trialing as like a family fund day. They were able to fundraise though to have their cost at $15 a day. Plus there's several AHS like direct day programs in Edmonton also that are all AHS staff and not contracted out. So there's probably another 5 or more in Edmonton, all with their own wait lists, wait times, things like that. Where we're seeing more of the need is in the rural setting. And like I said, as someone who has grown up and lived rural my entire life, and working in these communities also, I mean, Sherwood Park's not that rural. Leduc's a little rural, and Fort Saskatchewan, but we have people. I'm getting a referral from someone from Lamont because there's no day program near her, right? Or near, I don't even know if it's a her. I just assumed. uh, and Toefield, they just tried to run a day program, kind of on the side, which they had quite a few attendees for it. But again, they were kind of fundraised for it, but it was only a pilot project, right? But they seen great success and a need in that community. So how do we now work to try and help them build that, or if we could build that, right? It's more of that rural setting and those rural caregivers. Like I said, I am not 80 years old, but I feel 80 on the inside, and I hate driving in the city. So how do I get to my peeps to give them the support as caregivers and things like that, right? Or have a place where everyone can come together in those communities, because coming to the city is not an easy task. It takes all day, right?
Great. So we've got quite a bit in the chat box here. Just going back, I know Ellen had put in around that the online, also through Community Partners in Action out of Innisfail, there's the Let's Connect program, so people can sign into that. Ginger was just asking if anyone is partnered with Continuing Care Home in rural Alberta to have an adult day program that she'd love to hear from there, and her contact information is in the chat there. And then Michelle, you were wondering about the intergenerational day. So Michelle, are you based in Edmonton or are you? Okay, yes, okay. Okay. So I think, yeah, worth you guys kind of looking at different partnerships there for. And then Lisa was sharing that Westlock does have an adult day program and they're always looking for more clients. So if there's people around there. Linda was asking what the process was like to become a partner with Alberta Health Services.
No idea. No, I know the rough story. Our founder, Wendy Brown, she was a rec therapist in a lot of different places. She kind of fell into every one of these locations, actually. So it's someone
Weren't around yet.
I was not around yet. I think I was still in junior high, most likely elementary school.
We have though asked for more funding and been denied every single time. So
Yeah.
I don't know how you start it, but it's not easy to keep it going.
Yeah.
Like in the Leduc site, there was already a community survey done. There was an impact study done. That community had pretty much done everything, and just needed someone to take it over. Wendy had already been operating in Fort Saskatchewan. That's where she started in 2001, 2002. Which again, a lot of the AHS staff and community members had pulled together a lot of the information and they just needed someone to run it. And Wendy started her own business, took over, applied for the contract, waited, and got approved, right? Sherwood Park, she was having so many people come from Sherwood Park to the Fort Saskatchewan one that they were actually able to open the Sherwood Park site because so many people from Sherwood Park were coming to Fort Saskatchewan or wanting to, but couldn't handle the transportation aspect of it, right? And then, yeah, she was operating in Beaumont for a little while, but at that time, the population was so small that they were having troubles. She was trying to run a private day there, not funded by AHS, didn't go very well. They had troubles there having enough clients. And then Leduc had already started their impact and seeing how much support they needed there, right? So then they were like, oh, hey, well, the Beaumont one's not really running, but I think we're gonna get this AHS support in Leduc here. We've done all the work. Come run and take over this, right? So that's how she kind of fell into all three of these zones. But yeah, it takes a lot of community commitment together. You have to do your impact studies, you have to do your benefits and stuff, and then taking that. And pre-COVID, there was every 3 years you could apply for more spaces or to open up a new day program. Since COVID, everything's been a little murky on those timelines. And then also now with the great divide of AHS, things are getting even murkier. So they put a pause on all of those things also. But yeah, that is my understanding of how it all went down.
I'll just add to that, the kind of the usual way for things like that to happen, and of course, we'll have to see which organization it would end up being based out of, but usually there's a request for proposals that gets put out, and then things like those impact statements and, showing what your plan is, that would be part of that to apply to it. My understanding is that there's great interest and support for the day programs, but I think a lot of it is on hold because of the reorganization that's going on right now with it.
Yeah.
So Ellen just put her contact information in there if people want more about the Let's Connect program there. Oh, and our Drawson, Michelle was saying, has a community center that has potential if they aren't already running something there. That's great. Yeah, and as I'm looking at that and during your presentation, one of the things I was thinking about is how has it been being able to form kind of partnerships to have that support for running the programs, finding the spaces, some of those practical things. Has that been something that you've been able to capitalize on or maybe have plans to?
Well, like I said, in Fort Saskatchewan, we've only ever been in 2 locations, and that's our longest running site. So we originally were out of the Boys and Girls Club when Wendy first opened up, and about 2 years later, we moved to the First United Church in Fort Saskatchewan and have been there ever since. So we've been there a long time. Sherwood Park here, we operated out of several like community centers and halls over the years. So kind of like in Leduc, where we lived out of cabinets, right? Locked cabinets at halls. Show up on a Monday after there was a wedding there and having to clean the floors so that people could just walk in and not have their feet stick, right?
Great, yeah.
And then in about 13 years ago, we moved into this space, which we partnered with Heartland Housing, and they adapted a storage room for us that was originally meant for the affordable housing building here, so that we could have the day programs. So they included bathrooms, a kitchen, office space, and a storage room for us, and a quiet room. We have been reaching out to other organizations to maybe partner to move to maybe a more central location in Sherwood Park. Not that we have everything we need here except for an odd window. That would be very nice. That's okay. And then our Leduc site, we used to partner with the seniors, Telford House Seniors Center there. But they got so busy running their own programs, they kind of kicked us out, which we can't blame them, right? So then we've moved into several different churches within Leduc over the years. But most times when you approach, we've had the most success with churches, honestly, because they're always looking for renters. They usually have a large space, great big kitchens, and they're pretty reasonable pricing, right?
Yeah, and accessible bathrooms usually too, right?
Almost always accessible bathrooms. Yeah, it's very rare that you don't find one that is not accessible, but yeah. So we've had the most luck with churches, I would say, over the years.
And as for community partnerships, I think Fort Saskatchewan we have the best community partners out there. A lot of support from the county and everything. Leduc is getting there. Sherwood Park has been the hardest to connect with. Now that we're a nonprofit, they're a little bit more interested in chatting with us, and we've been doing a lot of reaching out. But like the family and community services in Leduc is very in Leduc and Fort Saskatchewan, very, very, very helpful. And
Fort Saskatchewan has a seniors coordinator that I co-host caregiver support group meetings with on a monthly basis. So we have community members coming in, plus our day program family members also, which is it's wonderful to see the community members and our caregivers supporting one another and sharing in conversations and helping direct each other, right? Leduc, we're definitely getting a better foothold with their seniors coordinator, talking out and reaching a lot more, and vice versa. Sherwood Park is probably our hardest for connecting with local FCS and things like that, especially over the years. Now that we, like Alison said, that we are a nonprofit, there's more talk, but it's, and just becoming a nonprofit itself has changed different organizations that we're working with and that are willing to work with us too, right? That we never had in the past.
So it kind of sounds like the space is a really important part of what people would need to look at or support, finding support in. And then are there other things that you find is key? I mean, obviously having the food being being suited to what people are able to eat and, you know, that kind of thing. But are there other kind of key aspects of it that if people were interested in exploring this, that they should dig into and get some information about?
The space, like as rec therapists, we really love our spaces and we love to change things around, right? So making sure that you have adaptable spaces, or big enough space for the amount of people that you're having, right? AHS requires that we need 5 square meters per person. I do believe it is 5 or 3, for the day program space. But really when you try and fit like 15 people into whatever space to do exercises, well, Fred is punching Joe in the face when they're doing arm stretches, right? Yeah. Like, so really looking at that, what is in the area for support staff also, right? The other thing you need to look at is what type of day program you would want to be, or what kind of supports you wanting to provide while you're running the day. Like, there is other day programs that are more medical based, that are rehab based, things like that. So having a clear vision of what and how you want to provide is really important before you get going. Meals, right? Everyone loves a good meal. I mean, that's the key to everyone's heart, right? Good snacks and good meals. They may have hated doing exercises, but they stayed because there's dessert later, okay? Yeah,
Great.
those are definitely key things. What are you actually wanting to accomplish, right?
Right.
What is your goal?
Right. Nice. Thank you. Thank you for that. Kathy, are you wanting to ask something there?
Just have a question, and I do apologize if I missed it. I had to run out for a second, but how are your staff funded? Are you, like, for the day center, do you hire staff just for the day center? Are you hired under your organization to perform the responsibilities and duties, or?
Yeah, so we hire staff, like each site is set up. We're a 5-to-1 ratio for clients to staff. So for every 5 clients, there's 1 staff. Each site has an activity coordinator and an activity aide. And then me and Alison oversee as rec therapists. Sometimes we count as members on the floor. So Monday, Wednesdays, I count as a staff member, right? We have staff that overlap at different locations because they're willing to travel. That is one of the biggest struggles we find within our organization is no one here works full time. None of our sites are, other than Sherwood Park, 5 days a week. Our other sites are 2 days a week, right? So trying to find a balance between the staff at each site and meeting the needs of people, that's probably our biggest struggle that we have as an organization. That's why lots of times we have staff working at multiple sites.
But we hire staff directly, not like we just rent spaces. So we're not getting staff from anybody.
Yeah,
It's just
there are staff.
So on your family funded days, how do you cover cost of meals and cost of staff?
Yes.
At $15 a head, that doesn't cover staff.
The family funded day is $40 a day.
Oh, okay.
The AHS days is mandated at $15, and AHS funds us for the rest of that cost.
And the only reason the family funded is 40 right now is because we've done a lot of fundraising. So we're subsidizing it for families to make it easier and less competitive for ourselves. But originally for a full day was $80 because that's what AHS is basically paying us. And we are minimal staff. I am the manager, the rec therapist, and the cook on Tuesdays and Fridays. Like we're minimal everything. So it's you do everything.
We all do everything. I like to call it a fluid. We're all fluid staff members. No one is above anything here. We all take turns cleaning the bathrooms at the end of the day or throughout the day. If someone's sick, anyone can be, pulled on, like anyone can be dealing with that. The only person we really don't like hanging out in the bathrooms or with sick people is our cook. So everyone else though, it's a team effort today. Every day.
Do you have volunteers that help with that at all?
Right.
We have volunteers, but we do not let any of the volunteers really help with personal care needs.
Right, yeah.
And we, being a wellness day program, within our guidelines, we say that we can assist with like incontinence or toileting needs on occasional basis. There are some clients that as they progress along, we know that they're on a wait list. We know their name's coming up soon, so we'll start assisting in the bathrooms if need be, because we know it's a temporary situation, right? And they're probably going to be placed in the next couple weeks or month, right? And that family still needs that respite. They still need that support. There's been an odd time that I have discharged people just to increase their care needs so that the family can have them move into care faster.
Interesting.
I know.
And just like our community partnerships, I would say that Fort Saskatchewan, we have the best volunteers.
Mhm.
Leduc, we are struggling with volunteers, and then Sherwood Park, it's always like whatever we get. We're connecting with like Volunteer Strathcona, which has really been helpful, but it is finding volunteers, getting our name out again. It's just the ongoing struggle.
And the fact that we only run during the day, right?
Yeah,
A lot of volunteers want to come in evenings or weekends and
right, yes.
we're not
yeah.
around.
Yeah.
We're at home chasing our children or
Yes.
other things.
So Leah just has a question in about on the family funded days. Is it school-aged children? So would it be homeschool-based families? Or are these days when there's PD days for those families that have children in school? Or what are the ages, I guess? Yeah.
So we do, after doing research, we found that age 4, 5, and 6 are your best ages. So we put 4+. In the summer, we fill up immediately.
Right.
Because we can get those kids. Our best group is because right now in this area, kindergarten is alternating days. So we take the Monday, Wednesday kindergarten kids because they have nothing to do on Tuesday. So
Right.
that's our best clientele right now.
For our little leisure leaders.
Yes, yeah. So I guess that would be pretty specific to the community then, about
Yeah.
who is around to do that. But that's interesting that it's the 4, 5, 6 that they.
Yeah,
shown
we've
to be.
tried to get in touch with like homeschools. They're really hard groups to break into. Like if anyone knows the secret passcode, I will take it. The secret knock, whatever it is, we'll definitely take that. We've been trying to reach out. We have no people in our own lives that do homeschooling, and even at that, we don't know the secret passwords. So
There you go. Yeah.
we would love to know though.
Right.
Yeah, but
Yes.
after like 6, it's a little bit harder to keep them for the day. They're not as engaged. They don't find the activities. I don't know.
Challenging enough.
Yeah, it's
Yeah.
a whole ball game. So like we have had sets of siblings come, and then the older sibling might help the younger sibling. They're a lot more timid around the seniors the older they get. Unless they've been in our program the whole time. We have had 2 who started with us in the pilot, and they're now they're 6, and those 2 are just like
they run the day. We don't need to do anything.
So,
yeah.
So important then around the whole stigma and reducing that, right, at a really young age. That's really interesting. Yeah.
The kids who have been around it the longest care the least about what's going on.
And actually their kindergarten teacher, because they go to the same school, has been like, they are such good helpers in kindergarten. They're such good leaders. They can organize things. They like, she's actually sponsoring us and like telling people, go see, enroll your kids with these people before they come to me, please.
That's great. Well, super. Any other questions from the group here? Let's see, we've got just about 7 minutes left here. It's been a great discussion so far. Okay, well, then maybe what I'll get you to do, if you can stop sharing, then I'll just bring up our resources that we wanted to share. We are. Thanks. So yeah, just a couple of webinars that I thought people might be interested in. One that is a recording is available from March 26th from Healthcare Excellence Canada, telling your organization's story to connect, inform, and amplify. So some of what you, Erin and Alison, were talking about, that PR and getting the message out there and how to do that. And then on May 28th, there's another one called Having Compassionate Conversations. So what does a good day look like? So kind of how to have some of those conversations with folks who are part of the programs, but also the family caregivers and that. And then just wanted to add to the publicity that's out there around the Healthy Aging Alberta Summit 2025, that the registration is open there now. So great. Any other resources that people would like to share with the group? If not, then I think we're done. Oh, Kathy, sorry. Yeah.
Sorry, I was just gonna say, if anybody is close to Cold Lake, we are offering on May the 2nd and 3rd. Hospice Palliative Care Association of Alberta is coming in to do a 2-day training with us. We did it again last year and it was absolutely excellent. And I think we're at about 35 registers so far for this year. But if you're close to Cold Lake and want to attend, it is on Eventbrite, so just check it out. And it's a great training program.
Yeah, and so if they wanted more information, just age-friendly Cold Lake, Kathy, is that who they could? Great, super. Great, thank you. Great. Okay. Well, thanks everyone, and thank you so much, Erin and Alison. This was great to have you share your information and to see you again today. So have a good rest of the week, everybody.